55. That is the number of Black women who died in 2020 per every 100,000 live births. Black women face 3 times the maternal mortality risk as white women, mostly because their pain is often overlooked or minimized by their practitioners, or they are faced with practitioners who tell them that their pain is a result of their own actions, that they are too fat, are too old, or that their dietary choices could have been better, or that the lack of prenatal care have increased their chances of dying during childbirth, ignoring medical malpractice as a play in this number. At the age of 12, I had no idea about this statistic and how I would need to look at my future doctors with skepticism when I was diagnosed with uterine fibroids. At the time, they were tiny, barely visible, and while my periods were painful, it was all that I had known, so it was normal. At 23, when I was met with the option of taking pills to battle the symptoms that I had been dealing with for 10 years, I didn't know that it would turn my life inside out. 2 years would pass, and I would find myself back inside that hospital room across from my doctor who told me that my fibroids had not only grown almost exponentially, but that I had a multitude that could not be measured. I remember feeling sick when she told me that I could try staying on the pill, and shrugged and told me not to get pregnant because then we'd have to worry about trying to do damage control afterward. So many questions bubbled to the surface, but before I could say anything, she was moving, getting up, and leaving the room. After that visit, I suffered from massive anxiety and felt like I was walking around with a heavy weight pressed into my back. I felt like I was suffocating, crushing all the dreams I'd had about conceiving one day. My story is one of thousands. There are countless untold stories of other Black women facing maltreatment from medical practitioners. Shalon Irvin, an epidemiologist for the CDC, who dedicated her life and her career to structural inequality and the need to address health disparities, died days after giving birth to her daughter due to her doctor not thinking that her pain was serious enough to keep looking deeper. Kira Johnson worked as a pilot, spoke 5 languages, and loved to travel. She gave birth in a top medical facility, and after no one listened to her husband's frantic calls for help, she died from postpartum hemorrhaging. Both women suffered because no medical practitioner believed them when they said that something was wrong. Societal norms in the medical field have long held that as Black women, we do not feel pain and that our cries can be ignored. But how did it come to this? How did we get here? As early as the 1600s, enslaved women's bodies were seen as ways to increase the workforce for slave owners, especially after the transatlantic slave trade ended in 1807 to 1808. This led to white physicians increasingly being called in to assist with quote unquote difficult births, examining the causes of why some enslaved women were infertile or could not carry to term, or to invest the cases of high infant mortality. Black women were expected to be not only pregnant routinely every 18 months to 2 years, but to continue with their physical labor on top of it, forcing mothers to either bring their babies into the fields or to leave them unattended for hours at a time. With the stop of the slave trades, a new scientific approach boomed, starting an era of medical experimentation and the neglect of reproduction freedom, as Black women were picked and prodded against their will and forced to endure unmedicated experimental surgeries because they were given no ownership of their own bodies by law. This maltreatment led to the advancement of the study of gynecology in service of healing white women of reproductive illness or injuries. It continued on, morphing into a more institutionalized practice of sterilization and eugenic control that occurred across the US in the early 1900s. At the time, there was no confirmed consent policies at hospitals allowing for the targeted, unauthorized hysterectomies under the guise of the betterment of social wellness. But we did not remain silent. Community groups like the National Council of Negro Women spoke out and influenced several other groups to follow them. Not only that, but we built our own clinics that educated Black women on how they can better support their own health. The historical foundations of our medical system has led to racialized norms and practices of discounting the pain of Black patients, institutionalizing reproductive control through public policy, and the stereotyping of women of color as unfit mothers. But we can do something. We can stand up for ourselves and each other. The CDC highlights ways that we can lower the maternal mortality rate of Black women. For starters, we can find practitioners that will listen and treat us with respect and care. We can familiarize ourselves with urgent maternal warning signs, employ a doula to be an advocate and an educator for ourselves. To help dismantle the medical disparity that Black women face, we as a society have to start listening to Black women when they speak out about their pain. We have to be a safe harbor as friends, family, partners, associates, colleagues, and most importantly, as medical practitioners. We also have to be a safe harbor for ourselves by calling out medical maltreatment, asking for a new physician, and never being afraid to speak out. As a 23-year-old, I thought my diagnosis would smother me. I was terrified of having surgery to remove my fibroids, risking death on an operating table with doctors that weren't listening to my pain. It left me to deteriorate. But then I met my new practitioner. She was a Black woman who specialized in uterine fibroids. She walked me through my scans and explained what my options were. She gave me information and answered every one of my questions. She listened, and even though my health outcome didn't change, I was now in control of my own future. That kindness and respect from my doctor changed my mental state regarding my situation. I could now tackle it, and I did. Now I stand before you confident and resolved, knowing that I can ask for clarity and demand respect from medical staff because my pain matters and I don't have to just deal with it. What I want you to take from my story is this: Black women deserve to be treated as equals in the healthcare field, working in collaboration with their healthcare providers to devise treatment plans and adhere to their own preferences. You can show up through voting on policy changes for women's rights to control their own bodies and supporting a Black woman when she says that she is in pain. My name is Diamond Thomas, and it has been a great pleasure to share my story with you.